Hello and welcome everyone. This is the Humans of Pharma platform by Pharma Academy, which is focusing on different pharma stories based on a pharma career, one's pharma journey, current affairs, and book discussions. This is the episode of Inspirational Pharma Journeys Direct Dil Se. And I'm going to take you along for another inspirational pharma journey where we'll be having a heart-to-heart discussion with a pharma leader. So, all the pharma professionals, freshers, and everyone else watching, let me take this opportunity to introduce our speaker for today, an accomplished marketing professional, Ms. Nivedita Parulekar. With over 25 years of experience, Ms. Nivedita is a marketing leader with a rich experience in crafting brand portfolio objectives, strategies, and plans to facilitate business growth. She has worked with leading companies like Sun Pharma, Merck, and Abbott, to name a few, handling local as well as global brand specialties for India in the cardiology and diabetes segment, respectively. She has an extensive experience at driving omnichannel marketing strategies, developing annual marketing budgets, and present product forecast to the senior leadership, and has been able to multiply 2 times growth for key growth portfolios of the organization. And it does not end here. Ms. Nivedita also has expertise in designing market research projects to access customer behavior. Moreover, she has presided as a guest lecturer, judge, and guest of honor at many pharma management colleges since 2019. She is a trusted business enabler, people leader, a strategic thinker, and is very well known for her attention to details along with the action and output-driven approach in her work. I heartily welcome Nivedita ma'am on behalf of Pharma Academy team and Humans of Pharma platform. Thank you so much, ma'am, for joining us here today.
Thank you, Gauravi, for giving me this opportunity to be here with you, and it's a pleasure to be here. Thanks.
Okay, ma'am. Thank you so much. Although we know that some questions are not enough to fit a person's journey into one frame, still we would try to know more about Nivedita ma'am through a series of questions. And here I go with the first one. Ma'am, from starting as a product manager to becoming the marketing excellence at a leading MNC, how has the journey been for you?
My journey has been incredibly rewarding, enriching. To start with, actually, I joined in IPCA in the international marketing. There I was working with international team, and at that time IPCA's international business was doing really well, and I was proud that I was a part of it. In 3 years, being the junior most member, I was guided well by my seniors, by my super bosses, and it was a great learning. But I wanted to be a part of domestic marketing, and therefore I shifted to Centaur Laboratories, where I was a brand manager of a leading brand, which is Synarest. Within that 1.5 year short stint, I would launch even Synarest nasal drops, and then started the with Sun Pharma, and then it was a more than 8 years experience. I launched multiple brands, line extensions, first time in India brands, build brands, loads of experience there. In the whole journey till there, what I realized, once you achieve the success, you tend to become more proactive and try to achieve more and more, which is a good part about the success stories, and that help you to grow, and the story continues actually. But in my next assignment, in my next job with the first brand, it was not a success. It was a shock to me, and then I decided to bounce back. I revisited the strategy. I found out where we went wrong, refine the strategic part, targeted customers, targeted only key specialties. And then I realized, and I think slowly, I think almost about 1.5 years, the brand came on track. So when I was in my next assignment, my first brand was not a success, where it was a shock, but I decided I'll bounce back. I revisited the strategy. I realized the segmentation I need to fine tune my messages also. And then after 1.5 years, the brand was on track. Of course, later on, there were a series of successes as well as failures. But one thing I wanted to share here, when you have a failure, you're thinking which is at the next level. You are in an uncomfortable situation and you try to come out of that at the earliest, and that time you are at your best when it comes to innovation, new ideas. So the success after failure is more rewarding than the success after success, what I realize. And then comes the marketing excellence assignment. Here it was a whole range of projects, assignments. It's not one restricted the way it was in the brand management. And that was the fun or the excitement all about. My 50% of the job was related to my individual projects, which I'm handling on my own, whereas 50% it was a collaboration with the team as well as the marketing team and other stakeholders. Yeah. So it was a 50% collaboration with the brand manager. It was a, a fun at one part, and it was a equally responsible, more responsibility, because being sharing as a sharing my ideas, my views as an expert, and equally responsible for that particular project. So it was all in all experience, a great experience, rewarding, as well as a lot of learning. And after that, now I thought what I'm good at, it's more to share so that I'll learn more. And now with into the education as well as the consultation, whereas I can learn more and I can share. And this is all about, in short, about my whole journey.
So moving ahead, ma'am, my next question for you would be, how do you think that your experiences in your childhood days have groomed you into the person you are today?
Was like everyone, the childhood, the way I was in as a kid helped me shape the way today I am, with my values, skills, and my interest as well. So as a child, I was very bubbly, as well as not so much quiet like a typical girl child, and very proactive in taking participation in elocution competition, drama, dances. And I was more keen on that. So if you ask me, even in 11th, 12th, I've opted for science. I was half the time I was in drama practice, and I used to listen a lot from my mother. So I was good good in that range in the study part. But what I did, I was made in a group where all my friends were in the toppers. So I was a part of that. So everybody felt like I was also a studious girl, which actually not. So, and if you ask me, these activities, I don't know why they called extracurricular, because they are actually curricular and not extra, because they are playing an important role in the your overall development. Now let's say a drama or a music, the simple voice modulation part, which helps in it helps in communication or effective communication. The way I have to talk to my juniors, to my sales, to the way I'm talking to my senior leadership team. So all these abilities you don't learn in school, but in all these extracurricular activities, which is again maybe a part of the school or outside of your school. Whereas when I was small, I was not so good in sports, but I liked to be a part of the team. And every day I used to come crying. But my mother was very persistent. Go fight. But that helped me to fight, helped me that building a spirit. I have to fight for myself. And again, my parents are allowing me to think on my own, select what I liked most. So that freedom gave me that sense of responsibility, and that's the great part about my parents. And of course, I have a lot of influence of my grandmother because she was most loving lady in my life. She taught me, she fought with me, but she had a lot of patience to, she allowed me to explore and learn at my own pace. So that was her best part. And she, with her experiences, she was trying to give me all her learnings. It was a selfless love what I experienced with her. And all these, even my teachers, uh, have a lot of learning and lot of influence as I was kid, and I'm still thankful for them. And that's the way it is. And I feel all these activities help me today what I am as a whole person, a marketeer, outspoken, reaching out to people. All these childhood, what you can say, those abilities help me uh, a lot.
Wonderful, ma'am. It's so good to know that Nivedita ma'am was so creative during her childhood, and that's how we are observing her these days as well. And indeed, ma'am, our family helps us become the best version of ourselves. So that was very heart touching. Okay, moving on. My next question for you would be, these days we hear a lot about CRM and omni-channel marketing. So, ma'am, would you like to share your views on it?
This, as per that saying, if they haven't heard it, you haven't said it. And it's really applicable in pharma because of the intense competition. And for that, I think CRM is the best tool. Like all other industries, I think customer relationship management has the key role. And it's not only HCP, but it is across the doctors, patients, caregivers, and it has its own effectiveness, and it offers the better patient care. When I was in brand management, I used to segment all my doctors into based on their specialty, and based on that I have a different initiatives, programs, and then I used to get the feedback and then refine my campaign and continue with this. But I feel what I was doing for a one specialty in all, like in the clinic, outside the clinic, medical initiative, marketing initiative, put together used to give me the benefit. Now, if you ask me, these are just a fraction of activities or maybe things of the past. Now, there are a lot of things which are coming up with which now it's easier to identify what exactly customer needs. And based on that need, we can segment, we can find out what we can offer that will help doctors for his better practice or better patient care. And there are many companies utilizing the tools, the digital tools, technical tools to find out and using it absolutely efficiently and doing the world-class programs. So it was earlier, it was difficult to even know the response of these activities, but now it's even easier to know, get the feedback, and we get the feedback immediately. So fine tuning is actually possible. So we understand whether to continue the program, how to what extent we need to continue, and then how to fine tune, how to build upon that. What I feel, what those companies who are doing it really well, they are the ideal one and setting the example for all others. They're exactly trying to find out what is the challenge or a concern, or even the success drivers for that matter, and then clubbing that with what the brand can offer, which is well aligned with the positioning or the key theme of the brand. And when you combine this and this, you have a design exceptional or innovative strategy. And then you have these multiple channels to cascade the programs pertaining to this. So like CRM, if it strategized and executed well, I'm sure the way it gives you an immense benefit. And it's not a, a brand benefit, it's benefit to the overall doctor and patient continuum. And so it's for the brand and overall business. So all this is all about when it comes to CRM. Coming to omni-channel marketing, so that I think there was a great progression which started with multi-channel and then we came to omni-channel, and every aspect had its own benefit. In multi-channel, we were putting doing multiple activities and trying to connect with that. Now with omni-channel, we are more systematic in the sense that we are talking about a single message, or lesser the better in this case when it comes to communication, because we need to uh, be selective yet innovative so that doctors have less efforts to recall. So in this case, this one single simple message we are cascading through a different way, different channels, and that's the beauty about the omni-channel marketing. In the whole this ecosystem, the best part is how we are empowering the medical representative, because this person was meeting or is meeting doctors maybe twice or a thrice a month. Now we are empowering him with multiple initiatives, maybe something through him and something directly reaching out to doctors. But as he is aware about, he's getting more opportunity to discuss with the doctors, getting more in clinic time. And as if he has done it, even he has that uh, ability and proud to be that I'm doing multiple activities beyond what is my own normal routine, connecting with the doctors and sharing the brand communication. So this is, I think, the best part about omni-channel. I wish I would have that at that time when I was in brand management. So I feel at the same time when things are so many things are available with you, it's, I think, more challenging now how you are leveraging to the best of your abilities and create a niche out of it. We have so many other examples from other industries and for the breakthroughs. And I'm sure even in pharmas also there will be breakthroughs with this.
Truly said, ma'am. I totally agree that digital transformation has truly changed the game for a CRM these days. And it is amazing how you have summed up these complicated subjects in such simple and yet effective words. So thank you so much. Okay, so my next question would be, ma'am, how is your life now as an independent consultant?
It's sort of a liberating. I can't say it's just a 2 months. So this achievement or a fulfillment is yet to know. But what I felt is I am now independent. I have a great work-life balance. I'm I'm studying a lot. I'm learning a lot. I'm reaching out to more people. It's like in last week I connected with the Mumbai's topmost neurosurgeon. At the same time, I'm connecting with the CEOs of the startups. So it was an amazing experience talking to these people, sharing, getting their views, which may not be possible when I was in my other earlier assignment. So this, while this was the good part, the challenging or uh, the responsibility part is I don't have the really the best or the maximum clarity the way should have how it will go, how I'll be performing and how it will be accepted. So from this perspective, of course, every coin has its two sides. So similarly, this consultation is has its own pros and cons. But I feel at this point, at this experience, it's worth evaluating and giving your best to this, so that the foundation of all this is uh, to share my knowledge with right from students to marketeers, and in the bargain I learn from them, because I when I was teaching to students, I feel there are lot many queries and lot many doubts, which itself is like, why I hadn't this doubt at all. That was my query. I somehow managed to answer, but so a lot of learning, even while connecting with students as well as marketeers. And of course, when it comes to the senior or the senior leadership team, it's altogether a new experience. But in the whole thing, what is one common thing? If you have a really clear objective, a good intent, people are ready to help you extend their and share their experiences. So it's a lot of learning, and in this, what is one thing you can share or cascade the learning from one to the others, and in a way you are trying to help so many at the same time, I feel, and in that bargain you are getting help from multiple things. And when you join such forums, clubs, there is a the best part is the sharings or the experiences which I learned or I came across, which are a huge knowledge, huge stories to learn. And that's I think I'm just trying to make my pluses side heavier, and trying to go ahead. And I think this will be an exciting thing.
And this is a very key takeaway for all of us, ma'am. I think we should all keep learning and keep moving forward.
Absolutely. So that learning never ends. And rather, if you ask me, I was more keen now than I was earlier, because when were working, I said, though I know, this I know as a marketer, so like we know we are the best. So so with this, now it's like I know really very less, and there is a ocean of knowledge in front of you. Knowledge is not just a theoretical knowledge, so many experiences, and of course nowadays avenues are also many more, and it's like how much you can take it up. And of course, you have to be really selective, focused in your approach so that you create your own identity, which is more important. What you want everyone, or rather, you want yourself to be known for first and then for everyone. So that you should be really very clear about it.
Okay, so now moving ahead, ma'am, I'd like to take this opportunity to ask you, is there a hobby or a go-to leisure activity that you have that you would like to share with all of us?
If you ask me, I just want to relax, chat with friends, and read a book. I love book reading, traveling to places, exploring. Uh, and when I go to places, I really want to be with that nat with those natives, try to find out how they uh, uh, spend their time, what are their hobbies. Because, see, even a simple place like Konkan, which is my native place, you will see a lot of different differences in the way. Prima facie, you feel the life there is slow, but it has its own charm and the way it is. So it's not something we are fast, so we are doing something. Even they are working. I think they are the best one because they are close to nature. Most of them are farmers. So I feel there is a lot to uh, absorb rather. It's not allowed to absorb and enjoy even in simplest just a 500 or a 900 kilometers away from our place. So I enjoy sports, watching sports. Along with that, I enjoy swimming and going to a long drive on a weekend, or simply relaxing, which also my hobbies. Cooking food comes last, of course. That's something. Yeah, but I'm a foodie. I relish all kind of food. That's about me.
Wonderful, ma'am. I totally can relate to that when you said like you're a foodie. Even I am. And okay, so
Yes.
ma'am, we'll move ahead. My next question would you like to share a story of a brand or a product that performed exceptionally well and that you're absolutely proud of?
In my segments in the Sun Pharma, when I received an antihypertensive brand, um, it was uh, it was only that was a single brand, and there were one or two extensions. And I was supposed to launch a one more line extension. But at the same time, what happened? There was a higher derivative or a higher molecule launch. And that was like a tense moment for for me as well as for my entire team. How now we will be able to continue, because it was a division second largest brand and a lot of expectation in terms of higher growth and profit generation. So we were evaluating multiple options, and then suddenly there was one study came for that particular molecule which I was handling. I think that was the strategy for the molecule internationally to launch and extend that lifespan of that particular molecule. But that was like a boon for me at that time, and had a fantastic medico marketing campaign with that. And then it was like all my competitors were launching the new molecule, and I was with that the best promoting, focusing on study and launching the line extension. Actually, that experience was uh, which was I could cherish till now, because I achieved a success because there were in the zones or the regions where I had strength, the doctors were particularly South Zone, where doctor acceptance was very good. So I could get that quick wins compared to the newer molecule. Of course, that newer molecule later on become much bigger, but at that time I achieved my objective. And later on, there were multiple successes. I launched in cardiac one more brand which was 15th, and I could manage it to the number 3 at that time. So there were multiple success stories, but working on something which was in that circumstances, which was a challenging circumstances, was a worth experiencing. And I felt later on I could manage doubling that entire antihypertensive portfolio. But of course, it was a long period, 4 to 5 years. But that was the beauty. That was the best part about it, which I enjoyed a lot.
That was a very interesting story, ma'am. Thank you for sharing. Okay, so moving ahead, ma'am, you have led some of the major products and brands in the Indian pharmaceutical industry. So, in the process, have you ever faced any major challenges that you would like to discuss about?
There were many, but when it was my first brand in the Centaur, it was an anti-cold brand, and in that there was one anti-allergic, phenylpropanolamine. There was internationally it was banned at that time, and we as a team decided we will replace that molecule as a responsible brand or a organization. And we changed the molecule, and we relaunched the brand. But the acceptance was not good. And we felt it was a marketing failure more than a medical one. But then we reach out to doctors. We have created a separate special educational campaign with the help of my medical team. And then I think slowly everybody started following that. The overall noise level has increased. But I think the credit goes to my brand in taking that first step. So it was a challenging at the start. I still felt that something not so what you can say risk taking, but you have to take that risk. And later on, there were a couple of similar incidences where I could share this experience and with the brand managers, and that I think that helped them to take that correct decisions, because such incidences are part and parcel of pharma marketing.
Yes, ma'am, totally. I agree. And as they say, like, if there's no risk, there's no gain.
There is no risk, there is right.
Okay, ma'am. So, unfortunately, we are at the last question for the day. So, I would like to ask you, what advice would you give to the freshers or even anyone watching this conversation who wants to pursue a career in pharma marketing?
I think pharma marketing is the best marketing, and and in the days to come, it will be better and better. Believe me, it's not that I'm just here and that's what I'm telling you. Uh, it's exciting because at the end, what you are doing something nice. You are helping patients, helping doctors for with a better medical management. You are doing a lot of initiatives which will help them. So it's a evergreen one, and we need a more better expertise to have something really exceptional which will help uh, the entire healthcare. So it's always uh, we want to make best thing better. I don't know whether I've used the right English, but I think my message is very clear because I request everyone to be more customer centric. So that's the crux of the entire marketing game. The more you become customer centric, evaluate every possible option for to be more customer centric. I'm sure you will all your subsequent steps will be the more easier for you because you are a marketer, you are a master of it. What is more what you want to know ki how you will capture that one thing what doctors or your customers are really looking at, be it a doctor or be it patient or be it caregiver, and how you are finding out that something unique in that. And I'm really happy to know companies are finding out multiple applications, softwares which are helping millions of patients to uh, continue their treatment, ease their treatment, even because their compliance, adherence are equally important in multiple facets. So, I will help help the patient with maybe simple packaging innovation or maybe simple formulation innovation. So how this how it how it's relevant based on the relevance or importance, how I'm capturing that. So all about the along with the customer centricity, how you are innovating, and it's spend some time with on yourself, updating your knowledge on that, because I know the marketers are always busy and you do lot of work for your brand, but spend some more time with yourself, updating yourself, mm, and how that will help you to come out with the best ideas about your brand. I think that's all what I wanted to say.
Thank you, ma'am. Your words are simple yet so effective and so profound. I'm sure every person in the audience must have learned valuable lessons from it. And we appreciate your presence here on this platform so much. So thank you so much once again, ma'am, for sparing some time from your busy schedule and being with us here today. And as we come to an end to this conversation, this has been indeed a treat to every pharma student, professional, and anyone who is interested in pharmaceutical marketing and sales. And to everyone who's watching, I hope you enjoyed this episode. Reach out to us if you have any suggestions for future episodes by connecting with us on LinkedIn and our other social media channels at Humans of Pharma, or by email at humansoffpharma@pharmastate.com. Until we meet again, bye.